Well, let's revisit our top story. And the National Assembly Health Committee has accused Cabinet Secretary Susan Nakhumicha of being a lame duck CS with the scandals at KEMSA and NHIF happening right under her nose. The CS admitted there were glaring red flags on large sums of monies paid to small private health facilities compared to referral hospitals. NTV's Melita Oletenkes has that report.
Hospital Insurance Fund and the Kenya Medical Supplies Authority are competing for the grand graft title, an egg in the face for Kenyans, while grasping at straws for being exposed by the media.
I had already asked the board to start their investigations. By the time media was picking it, is after they realized that investigations are going on, and some included visiting those facilities. So if the media that highlighted this issue was to be forthright, they will say it is part of the investigations that was going on.
While appearing before the National Assembly Health Committee Tuesday, Health CS Susan Nakhumicha admitted that the payment of hundreds of millions of shillings to small private hospitals as captured in the NTV expose was a red flag, an indicator of choreographed graft.
Chair and honorable members, it will shock you that of the payments we made this month, after having delays from Exchequer for a long time, the top facility to be paid is one that we have suspended. And in all honesty, and I am yet to be convinced, that you will have a small private facilities doing more surgeries than Kenyatta, than Moi, than KU, all these public facilities combined. We have some small health, and it is not the Aga Khans, the Nairobis, and the big currents that you hear about.
But let's not lose sight of the 3.7 billion shillings malaria net scandal. The acting CEO of KEMSA has been put on the spot by the Committee on Alterations on the Global Fund tender document, but the CS jumped to his defense.
This meeting, he had not anticipated that he would be asked to respond as the director then. So he prepared his response as the CEO of KEMSA. So I wanted to seek.
There's any person who is well suited to explain, even when he's woken up at 2 a.m. It's Dr. Mura, because he was in charge of this particular.
The Health Committee has hinted on proposing an inquiry into KEMSA and NHIF to get to the bottom of the underlying and perennial graft cases. Melita Oletenkes, NTV.